Happy Hump Day, caller and receiver here. Today, I want to tell you two things that you may be doing with your website that are costing you patience as we continue our week-long look at things dentists are doing in their marketing that they shouldn't be. Stay tuned. Welcome to the Patient Attraction Podcast. Today, we're going to focus on your website. One of the biggest mistakes I see dentists making is having what I call a slider image on their homepage. That slider is a box or a rotating image that slides from side to side on their homepage. And it's a very common theme in WordPress and a lot of old websites. A lot of websites use a very outdated technology called Flash to do it. Here's why slider images don't work. Research shows it takes website visitors less than a second to form a first impression. It takes users about 2.6 seconds for a visitor to land on the area of the website that's going to most influence their impression of the site. More than half of all visitors spend less than 15 seconds on a page. So either your visitor does nothing but watch your slider images before bouncing off the page, or your visitor doesn't focus on the slider image, and either way, the slider does you very little good, despite taking up a good amount of your above-the-fold real estate on your website, or the point where the viewer has to scroll to see more on the page. My recommendation is to move away from sliders to either a static image that has a great call to action, or even better, video, or even better, some kind of direct response metric. Video engagement is the most significant way to build rapport with your patients and make them feel confident that making an appointment with you is the right decision. Another big mistake I see with many dental websites out there is having multiple websites. Now, having multiple websites isn't a problem on its face, and we used to use multiple websites several years ago very, very effectively. The problem nowadays is that those websites have redundant or duplicate content. And if you followed Google at all over the last few years, you know that duplicate cookie cutter content is a big no-no for search engine optimization. Multiple websites are okay if you want to position yourself in several niches using multiple marketing strategies. But I still recommend consolidating your websites and getting all of your traffic aimed at one core site. This is going to give you the single site the most authority to move you up in the search engine rankings rather than splitting your power among several websites. Then, here's a very practical reason. Keep your website fresh. Produce constant new content that's going to keep your website fresh and keep it from looking stale. From an ROI perspective, it takes much less effort to keep one site updated than it does 2 or 3. This also reduces confusion among your patients, if they come across multiple websites. I hope you found this podcast valuable today. If you'd like me to evaluate your website, go to smartboxwebmarketing.com and click on products and then go to our Swift Kick dental website review. You can learn more on that page or give my office a call and we'll walk you through our 131-point dental web marketing checklist. That way, you know what you're doing right and what's costing you more and better patients. Come back tomorrow. I want to tell you 2 numbers that dentists focus on that are not indicators of success. Keep moving forward.